My name is Haley Fine. I'm in nursing 1219. I've looked over my patient's record and confirmed that we're going to be doing this procedure today. I'm going to wash my hands and provide hand hygiene and provide privacy. Can you tell me your name and date of birth, please? I'm going to take their armband. Today, we are just going to be inserting an IV and giving you fluids and blood. I've obtained consent, and is that okay with you? All right. Now we're going to begin prepping the IV. First, I'm going to put on my gloves. My start kit, I'm going to be getting out my tourniquet. I'm going to place it 4 to 6 inches above my insertion site. Okay, I'm now going to be palpating the vein. That looks good, so I'm going to release my tourniquet. Now I'm going to get my solution. I'm going to prep the area inside outward. I'm going to discard of that, let it dry. Now I'm going to get my needle ready. Okay. Since that is dried, I'm going to apply my tourniquet again. It might be a little tight, but there we go. I'm not going to leave it on for more than 2 minutes. Now I'm going to get my needle ready. My bevel is up, and I'm going to insert it into my patient's vein. I've gotten blood return, so I'm going to advance it all the way into my patient. I'm going to pop the tourniquet, pull the safety feature, and inform my patient that that is normal and okay. All right, I'm going to clean that off. Okay, I'm going to discard this into my sharps container. Next, I'm going to be flushing my catheter. I'm going to draw back to confirm blood. I'm getting some blood, so I'm going to flush slowly. Okay, now I'm going to be getting my bandage to place over my insertion site. All right, just gonna tidy up a little bit. I'm going to name and date my bandage site. Move my tourniquet. Now I'm going to be prepping to insert fluids. First thing I'm going to do is get my tubing ready. All right, I'm going to make sure my rolling clamp is 1 to 2 inches and that it's cut off. I'm just gonna go ahead and clamp all my sites. Now that I've got my tubing, I'm also going to get my normal saline. I am going to do my medication check. I'm also going to squeeze my saline to make sure there's no leaks. I'm going to check the expiration date and confirm patency in my saline. Now I'm going to begin to stick my saline. All right, I'm gonna hang that up here, and now I'm gonna make sure that's closed, but my saline is open. I'm gonna give it a good squeeze, fill it up about halfway, close that back off, and now I'm going to prime my tube. I'm gonna let my saline run. There we go. That is good. My tube is primed. Going to remove my flush. I'm gonna swab each site and put that. Next, I'm going to be doing blood. I've received my signed consent from my patient. I'm going to obtain pre-infusion vital signs. And now I'm going to get my blood. I am going to have another RN present with me to make sure I'm doing everything correctly. I'm going to check this with the form on the blood and the blood armband. Make sure the expiration date. Have the other RN check over me. We're both going to sign and everything checks out right. Now I'm going to be sticking this okay. I'm going to pierce my blood. Sure that's in there good, and now I'm going to be hanging it. I'm going to open up my blood tube and squeeze some blood into here. Okay, and now I'm going to open this, set my tubing to the doctor's ordered rate, let my blood flow into my patient. All right. Now I'm going to make sure there's no air bubbles. I would also do that when I was doing my saline. I would tap it if there was. Now I'm going to obtain another set of vital signs and stay with my patient for 15 minutes. Then after that, obtain them every hour. All right, that's it for my blood. Next, I'm going to be discontinuing. First, I'm going to make sure all my things are closed. The doctor has ordered for the IV to be discontinued. I would wash my hands and put on a new pair of gloves. First thing I'm going to do, I would also be sure to label my tubing and blood and saline when I was doing that earlier. I'm going to loosen the edges of my site. Okay. I could also use alcohol to help me loosen that if need be. Next, I'm going to get my pad and place it over my insertion site, and I'm going to remove. I'm going to inspect my catheter for any make sure it's all intact. I'll discard that into here with it disconnected from the tubing. Now I'm going to remove that. I'm going to inspect my site, make sure that's okay. Next, I'm going to place gauze over my site and tape a bandage on it, and that will complete my IV insertion.